Which makes you harder longer, Viagra or Cialis? That's what we're going to get into today. Welcome back to the channel with me, your host, Dr. Debra Durst, and I have a co-host with me, a special and newer co-host.
So hello, my name is Nicole Campbell. I'm a nurse practitioner at Revitalize, working along with her other co-host, Faraday. I didn't take her place, but she'll be back next time.
Yes. No, there is no replacement of Faraday.
No.
We all know that. But Nicole is now working alongside us,
Mhm.
and so she's going to be on having conversations too. And so today we're going to get into which lasts longer, Viagra or Cialis. It's a frequent question that we have. So if you're not familiar with those agents, again, it's the little blue pill. People are familiar with that. And Viagra is Sildenafil and Cialis is Tadalafil. But both of those are PD-5 inhibitors, and most frequently we're talking about the little blue pill or Viagra or Cialis. And by PD-5 inhibitors, really in simplistic terms, it really just means it's blocking a reaction in the body that results in better blood flow. So better erections, but also works with women for better erections for women. And if you don't know what that means, it's arousal. So the vulva gets engorged, the clitoris gets engorged, and the clitoris is way bigger than just what you're seeing. So it's engorgement of the entire female sexual system. So great for women too. So if we're getting into duration of action, so let's talk about Viagra first, since that was the first to market.
So Viagra, Sildenafil, is your shorter acting of the two. Everybody's going to respond a little bit differently to either one, but typically the Viagra is shorter acting, but tends to have a little bit more side effects than its cohorts, the Cialis.
Yes. And so Cialis is the longer acting. So you can get up to 18 hours with Cialis, where, you're talking about maybe 4 to 6 with Viagra. And I do tend to think that Viagra is a little more potent for some. They get more in the way of side effects, like you mentioned. And then also some men tend to prefer it because they feel like it's a little stronger. But ultimately, Cialis is the longer acting. And we do like to use a combo product. Have you used a lot of that in the men, the combo?
Yeah, we use the combo troches, a little of both of the Sildenafil and the Tadalafil, and usually they get a pretty good response and prefer to have less side effects with just as sustained and strong as erections.
Yeah. And so if you're not familiar with number one, compounded is where we can customize that product through a compounding pharmacy, which for the record, they are regulated, and they're actually even more regulated because on the state and the federal level. And so, and again, there's bad actors in every industry. And so you just need a trusted pharmacy and trusted office that's using the right pharmacies, but they can compound. It's very safe. It allows us to customize, and we can create products such as the troche, which troche goes underneath your tongue and it dissolves slowly, bypasses the GI tract, and basically gets right into the system. And then we compound Viagra and Cialis both in a low dose. And so you get the best of both worlds, and it works better, and men tend to love it because now you have the short acting, the long acting. You don't have to time it. You can actually take it once a day because in that low dose, there's lots of studies to support anti-inflammatory effects in the body with some anti-aging benefits. Yeah. So it's an awesome product. But some of the side effects that you may get, and then we're going to get to probably one of the most important points of all of Cialis and Viagra. We already got to the fact that Cialis will last longer, but some men might not feel like it's strong enough, so they might still like Viagra. You just have to take it more frequently. But there's a really important point to all of them, but we'll talk about side effects first. The side effects that you've heard most frequently are what?
Flushing. From flushing, headaches, sometimes some vision changes. Sometimes some patients have had some palpitations or heart racing. That's usually a big turnoff that they won't use that item anymore. Prolonged erections is a big one. That is something to be on the horizon that everybody needs to be aware of and needs to know how to treat as long as you're taking a PD-5 inhibitor.
Yeah, so that is definitely the most serious side effect that you can have, and that's a prolonged erection. So if there's an erection lasting longer than 4 hours, that you need to seek medical care. And actually, we give them precautions even when we're prescribing anything that can increase blood flow to the erections or to the penis, that if they have a prolonged, there's some things that you can do as well, such as walking and a decongestant. Because I will say that nasal congestion is one of the big ones that you can see, which brings us to one of the most important points of all of the Cialis Viagra debate, but also the fact that men will use a decongestant sometimes because they know they're going to get that side effect, which there's no point in even taking it if you're going to do that, because that's the reversal agent. And so walking and a decongestant is something that can reverse a prolonged erection because it's reversing the effects of the medication. And so just know that if you take a decongestant because you know you're going to get the side effect of nasal congestion, you might not, or you may as well not even take the medication. But it brings us to the most important question that we get asked, like Viagra or Cialis or the little blue pill before dinner or after dinner. And it seems to me, and you may have run across this as well, that men don't want to take it before dinner because they're afraid they're going to get an erection at dinner and miss the key time when they need it after dinner. But just know that it doesn't cause spontaneous erections. You still have to have arousal, but then you get better blood flow when you get aroused. So you definitely want to take it before dinner because it doesn't work if you take it with food. And that is frequently a key point that physicians that prescribe it don't tell patients. It was like a huge, like a large amount of comments just in the fact that they had been written and they had been taking and no one told them to take it on an empty stomach. So key point, take it on an empty stomach, and before dinner, you have to be aroused to get an erection. If you have the combination product, then you definitely are going to have that prolonged effect. Also, Cialis would be the one to take if, say, you're planning on dinner and dancing and not, getting into the bedroom until later that night. You might want to take the longer acting one. And so the troche that goes underneath the tongue does bypass the GI tract. But with that, I still say to take it on an empty stomach because some of it's going to be absorbed. And so those are the things, the big questions about Cialis and Viagra. But the other key point that we do with our patients is we discuss the fact that you actually need nitric oxide production for these agents to work. And so a lot of men will do an amino acid like an L-arginine to increase nitric oxide production. And a lot of men that don't get effects with Cialis or Viagra feel like it just didn't work for them. And they've tried both. They get side effects. They don't like it. It's a full dose. They're trying lots of things that are wrong with the potential, how you're trying it, the steps and what you're trying to see if it works for you. But I would say that you want to time it. So if you know you can time it perfectly, use a short acting, that's fine. If you're getting side effects, you can try a low dose and not do a full dose. There's that potential you can do them together where timing's less an issue. Take it on an empty stomach. But the key point is you need nitric oxide production. And if you're older, that pathway for the amino acids is not as active. So having a product like Berkeley Life that provides all the nitrates, that is a key point for nitric oxide production, which is necessary for these agents. So if it's not working, that's another potential that you might want to try. And so that's another thing that we'll do in the office. Have you done the little test strips too underneath patients' tongues when they're in there?
Give them a little testing kit, has a little litmus paper in there and the instructions, and then has the Berkeley Life nitric oxide in there. So they all get a little kit for them to try and test it out and see how it works on them. And most are surprised to find out that they have very low nitric oxide levels.
Low, and then actually a couple hours after the 2 capsules, which provide you all the nitrate, which is necessary for that nutrient pathway of nitric oxide production. So there's the amino acid pathway, there's the nutrient pathway, but if the amino acid one is not working, the nitrate will. But 2 capsules daily provide you the nitrates necessary for nitric oxide production, which is huge overall, not just for erections, but overall health.
All over, over your cellular function.
Cellular function across the board. So it's an anti-aging agent that you want to have enough of in your body, but you also want enough of it for erections and then also for these agents to help. So before you absolutely say that Viagra or Cialis doesn't work, just know that there's those steps. It's the timing. It's is it a full dose or a half dose do you need maybe potentially a combo agent or combining them together. Nitric oxide production, do you have enough of it? And key, did you take it on an empty stomach? Because if you take it with food, you might as well not take it. You're going to not get the effects that you want. So anyhow, those are the key points. Can you think of anything else? Be careful of the prolonged erection if that happens.
Yeah, just the prolonged erection is a major one. Just that's a medical emergency, and just make sure you have some education on that. Erection longer than 4 hours to go to the emergency room.
And I have a theory that if somebody gets a prolonged erection with a PD5 inhibitor, that erections probably aren't a big issue for them.
Correct.
And so that we have to question whether we really need it. Because most of our men that were actually improving erection quality by doing regenerative treatments, this is one of the agents that ultimately we want to get them off of if we want to step them up one. So like if they're on PD5 inhibitors, to try and get them off of those and to have strong erections without them. But if you're using that and have issues with the opposite, a prolonged erection, you might be at a point where just maybe nitric oxide production
is enough for you.
So those are just little things to think about. Let us know what you think, any other questions you have. Let's start a conversation in the comments and let us know if there's anything else you want to talk about. We're willing to deep dive into anything wellness or sexual wellness. And thank you, Nicole,
Thank you
for being with me today.